Yeah, let's talk about these pathways real quick. The reason I want to go over these pathways is I kind of want you guys to know what options you have starting with this class for the next couple of years. You guys can kind of get a plan in your head of what you really want to do. So this class, Principles, like I said last week in the videos, it's just an introductory class. It's like the purpose of this class is really just to introduce you to the healthcare field as a whole. Now, I'll talk about nursing a lot, but that's just because that's my background. I don't expect everybody to want to be nurses. I don't want you all necessarily to be nurses. Everybody's good at different things. But I'll refer to that a lot just because that's where I draw my experience from. So you'll hear me talk about it, but that doesn't mean I want you to necessarily be a nurse or whatever. That's just what I'm going to discuss because that's what I know the most about. Anyway, so we'll talk about lots of different careers in healthcare. So that's the purpose of this class. So you get to the end of this year, and all of you guys are sophomores, right? Okay. So if you get to the end of this year, you're like, okay, I really like this class. I really think I might want to be in healthcare or do something in healthcare. That's awesome. Here are the options beyond this. So you can either take this class and be done. Maybe you decide, I don't really like healthcare. That wasn't very interesting. That's not what I want to do. I'm glad that you figured that out now and not 10 years from now, okay? Option number 2 on here is the pharmacy tech pathway. And what it's talking about is you can actually, by the time you graduate school, you can have finished a course to teach you how to be a pharmacy technician. Now, in order to do that, you can take this class as a sophomore like you guys are doing, or you can actually take it as a junior. And then your senior year, you'll come back and you'll take the Health Science 2 class. It's actually just called Health Science. It's a 2-period class. So you start out with that in the fall. Like it says, fall semester, you do clinical rotations and health science class. That's where we'll go to the hospital for clinical rotations, and you just get to do job shadowing. It's twice a week for an hour and a half. I think this year we're doing it for like 7 weeks. Typically it's 7 or 8 weeks. So do that in the fall, and then in the spring we actually start the pharmacy tech class. I teach a portion of that, but you also do a portion of it online. So that's that option there. Your junior year, for those of you guys who decide you do want to do the pharmacy tech route, you could take like nutrition or child development. Those are other classes that have to do with healthcare. There's other options. Or you can not take any kind of health class. Okay, and then so if you want to do pharmacy tech, you wouldn't do anything necessarily with me as a junior. In your senior year, you come back, you do Health Science 2 and Pharmacy Tech. Health Science 2 is first semester, Pharmacy Tech second semester. It's 2 years. Okay, if you decide you want to keep going and you want to go the nurse aide pathway, okay, option 3 is the CNA pathway, Certified Nurse Aide. So you can actually graduate high school and have already tested and be certified to be a certified nurse aide. When you graduate high school, you go this other route. So what you would do is this class you take now as a sophomore. Your junior year, you actually take Health Science 2. So in the fall, you take the 2-period course where we do clinicals and all that. And then in the spring, you actually start the coursework for the Certified Nurse Aide program. That would be spring of your junior year. You go to Commerce. PJC actually teaches the course, but it's taught at Commerce High School. So you go over to Commerce, take the course with them junior year, and then all of the senior year, you go to Commerce and take that course. And by the end of your senior year, they actually administer the exam and everything. You can graduate and already have that certification, which is a great certification to have because you can make a good bit more than minimum wage. It's just a certification, so can't expect to make like a nurse makes, but you can make good money that way. And plus that if you want to do nursing, that's a great route to go separately if you put in your experience wise. So if nursing is something you guys really want to do, I would strongly encourage you to go this certified nursing route. Pharmacy tech is great too, because you're going to have to know that anyways as a nurse. But other areas, physical therapist and nurse aide would be a great thing to do with that. Pharmacy would be the same. Anyway, so those are kind of your options. That clears my. Does that make sense though? You've got your two options, main options of what you can do after this class. That's why I like to get people in here as a sophomore, so you actually have the option. Because otherwise, if you don't start this class until your junior year, then you can't start this in May. Okay, any questions about that? Is that really confusing? Okay, good. Okay. Well, make sure that you study for your payday. Keep in mind too, all of the payday quizzes at the end of this week average together for test grade. Did any of you guys have questions on your research agency? Anybody having trouble with that?
I have basically just a general question on it. When you want us to provide examples, I mean, I provided an example for like cookie, but I only have one. I kind of wrote out what I was going to say, and I figured out
I mean, as much as I want to know all about it, so as much information as you can know. Yeah. Yes. Veterans Affairs. Yes, but yeah, it should be the same. But Veterans Affairs may have to do more with them as a whole versus just the healthcare part of it. I'm really looking more at the healthcare part, like the VA hospital. If you want to look at the hospital specifically, that's fine. Does that make sense? But yes, they're all related. So if that's what you find, that's fine. Anybody else have any questions about yours? Funding is the part a lot of people struggle with. They just have trouble finding it. It's pretty, once you figure it out, it's just like, there's pretty much just three options. But, okay. Now remember, this presentation, we won't be grading your presentation just like presenting it. This is kind of just like a trial run for your presentation. I'm going to grade the information that you get, but not necessarily your presentation. Normally I will. That'll be 25% of your grade. I'm just not doing it this time. Let everybody get used to getting up in front of everybody. We're going to get up in front of everybody a lot this year. So it's really good practice for you guys. It'll make you a lot more confident, I think, because we do it so much in here. Which, and it, it's just part of life. So that's the way it is. What else? And the other class asked a question too, just so on this weekly paper, that's one thing y'all need to look at every day is your weekly paper that has the assignments on it, because especially with us flip-flopping with me and Miss Pickering, this is my way of communicating with you guys even when I'm not here. This is what to do. This is what I expect from you, okay? So make sure you're looking at that, because I'm going to try to put on here when things are due so that you'll know, okay, go through here, make sure you get that turned in. Because what I'm going to look at is like everything that gets turned in, Miss Pickering is dating it, date stamping it for me, and that's what I'm using to determine if it's a late grade or not. So she's going to date stamp it every day. So just so that you guys know, make sure you look at this every day. If you lose it, get somebody's and turn to the library, make a copy of it. Okay. Everybody usually does really well on this healthcare agency thing. I usually have really good grades on that. So, One of the questions somebody asked earlier, okay, tomorrow's the payday, Friday is the insurance quiz. We won't normally have 2 quizzes in 1 week. We just are because there's a lot of insurance vocabulary that I want to make sure that you guys know. So those are 2 separate quizzes. The quiz for Friday, all those words are listed on today's assignment paper, and we will actually go over all those in our lecture. So we better get started. Why am I talking about? Is that right? Oh yeah, this is 7th grade, isn't it? Okay, so let's look at insurance. What are some words that come to mind when you guys think of insurance? Just some words that come to mind. Medicaid. Do it? Medicaid. Medicaid. What else?
Coverage.
Coverage. Just random words. What's the first thing that pops into your mind when you think of insurance? Life insurance? Life insurance. Okay. The Geico. Farmers with the. I've seen that one commercial with the old man, and he's got that fishing pole, and he's dangling that money in front of. That still cracks me up every single time I watch it. You know what? Have you seen it? The old man, and he's like dangling that money, and he's like, whoo. There are sometimes you do lose money in insurance, unfortunately. It's one of those things that you hate to buy, but you can't afford not to have, kind of thing. You know, it's like, oh. So, good. Those are all things. Medicaid, we'll talk about Medicaid for sure, and all those things. So, good. So, insurance is really just a way for you to it's something that you put your money in towards in hopes that if something crazy happens, they will help you cover the cost of whatever it is that you're insuring. So if I insure my car, I pay every month my car premium, whatever it is, $30, we'll say, in hopes that if I have an accident and it costs me $10,000 to fix my car, they're going to come back and fix my car because I've been paying insurance. Same thing with health insurance. So I pay a certain amount of money every month in hopes that if something happens, or like for me, I had a baby this summer, then they'll help me pay for the bills for that. But many people in the U.S. are uninsured, and they assume all responsibility for healthcare costs. Now, this is dwindling some because of the laws that Obama has put into place about healthcare, and we will talk about some of that. There's some really good things in there. There's some things that aren't so good in there, but that's just, I think they'll ever be perfect, but. So why do you think that is? Why do you think there have, one of the things, and one of the main points with Obamacare is that everybody needs health insurance. So what he has put into place, or what this law says, is that if you don't have health insurance, then you will have to pay a fine, basically. It has to do with whenever you pay your taxes. You have to pay in a lot of money if you don't take out health insurance. So why do you think, okay, and this is why he did that, because we do have so many people who are uninsured. Why do you think there are so many people who are uninsured? They can't afford it.
And he's basically saying, well, you're going to put money towards a finer health care, so you guys will get something out of it now.
That's it. Here's what happens, okay? So, and I'm not sure, some of you may not know exactly how this works. So, Medicaid is a state-funded health insurance. Each state determines, so like Texas, as a state, pays for Medicaid. They're the ones who put up the money there. So, now Medicare, which is the one for elderly people, that is a federally funded. So, the United States government is the one that funds Medicare. State governments fund Medicaid. So but with Medicaid, in order for someone to qualify for Medicaid, their household has to make below a certain amount of money to qualify for that. Now, there's also a children's Medicaid called CHIP, and probably a lot of you guys have heard that. Probably a lot of you guys are on that. Now, you can make your your household income can be significantly more and you still qualify for CHIP versus Medicaid. So like a kid who qualifies for CHIP doesn't necessarily mean that their parents are going to qualify for Medicaid. Because you can make a lot more money and qualify for CHIP than for Medicaid. So what ends up happening is you have Medicaid. So you have people who are make a low enough amount to qualify for Medicaid, and then you have people who make enough money to be able to afford insurance. Insurance is really expensive. I mean, really expensive. I had a family member who was paying, I think he has to pay his privately because he's like self-employed. And I mean, I'm talking in the thousands. It's how much every month is how much it costs. I mean, it's crazy. So you've got people who don't make enough money, so they qualify for Medicaid, and then you got people who make enough money to buy their insurance, or at least make enough to have to buy their insurance, I guess. But you have a lot of people in the middle of that who make too much money to qualify for Medicaid, but don't make enough money to be able to put back all this money towards insurance. So you get that group of people in there that are uninsured, and there's a lot of people who fall into that category. And it's not anything they did. It's not anything, that's just the way it is. And so what happens is when you don't have insurance, a lot of doctors' offices won't see you. They just won't. They won't take somebody without insurance unless they're going to pay, cash up front or whatever. And so what ends up happening is people, one, because they can't afford it, they won't go to the doctor. And then they'll end up in the emergency room because they didn't go to the doctor, which was something that was, not that big of a deal, and now it's turned into a big deal. So they go to the emergency room, and they go to the emergency room, and the emergency room has to treat everybody, at least get them stable. They can't just say, no, we can't see you, and send them out on their way. They can't do that. Not an emergency room. Now, a doctor's office can do that, but not an emergency room. It's a law. They can't. So you have people who go into the emergency room, get seen for a cold or a virus or something like that, and then they leave. Well, they get a bill, but they may never pay it. And so, because it's just going to be ridiculously expensive. Well, it's expensive for everybody. It's much more expensive to go to the emergency room than it is to go to the doctor's office. Just a lot more people involved, a lot more paperwork involved, a lot more everything involved. So that's part of the reason why he has mandated that everybody get insurance, because that helps to pay to cover some of that cost. And I'm probably losing you guys because I'm getting boring, but it's just the way life is. But anyway, so that's a big issue. People not being insured is an issue for that reason. Now, one of the other things Obamacare has done is they have put together this. Oh my gosh, what is it called? Health care marketplace. So you can go on and find a policy. They just made it really easy for you to find an insurance policy that works. So that was part of it too, which is nice that people can go in and just find one, So that's good. But anyway, so that's a big deal because people who are uninsured end up costing everybody else money when they go to the emergency room and don't pay their bills. Well, that increases the cost of healthcare for everybody else, all the way around. That's just the way it works. I mean, it's not that they don't pay their bill, so that's free healthcare. It's that they don't pay their bill, but it still has to get paid by somebody somewhere along the way. So, but like I said, I mean, it's not even necessarily anything that they can help. That's just the way it is. They try to stick it out on their own without going to see a doctor. They can't. They get really sick. They go to the emergency room. So it says that insurance decreases out-of-pocket expenses. Out-of-pocket, that word, sometimes you'll see it abbreviated OOP. That is, that just means the amount of money that you pay or you have to pay out of your own pocket. That's outside of like the cost of the insurance to you. It's what you pay out of your pocket. That's why it's called that. So it says companies purchase health insurance for employees. And that's something else that Obamacare put into effect, is that employers have to offer some kind of help. It's like, I guess your business has to be so big before you have to offer it. You have to offer healthcare insurance to your employees. So that's the other thing. Because eligibility depends upon continuous employment. So if I quit working at the school, they don't have to keep paying my health insurance. I have to be offered to keep paying for it myself, but they don't have to keep paying for it, obviously. Employees must work 20 or more hours a week, so they have to be at least more than half-time working-wise. And then a lot of them have a waiting period. So like at my last job, I had to wait 3 months. I paid all my insurance, but I had to wait 3 months before I could actually use it. I guess they just want to know that you're going to stick with your job before they start telling them a whole bunch of money for your insurance. Which makes sense. Now this says pre-existing conditions may be ineligible. That's not necessarily true anymore. That's one of the other things that Obama's healthcare plan got rid of, is that pre-existing conditions means, okay, so here's an example. So our insurance starts September 1st, but if I had diabetes and was diagnosed in April, okay, before Obamacare, the insurance would not have to cover my condition because it was pre-existing. It existed before I started on my insurance. But now, one of the things with Obamacare is that they can no longer deny me insurance if I have a pre-existing condition. So that's a really good thing for the people who have the age of pre-existing conditions. It's not so good thing for everybody else because you get paid more money. But
would the insurance do it if somebody was like born with the condition? Could they still deny them because it was pre-existing?
I think that they used to could, but not anymore. It depends on. There's a whole lot more involved. It's more than just like a yes or no answer. If that makes sense. But a lot of times, if you're born with something that really, if you're born with something that would disable you, like let's say you're born with spina bifida, that's something that I would think you would always be covered under either Medicaid or Medicare. Would always cover something like that. That makes sense. So there's other avenues to get insurance for something like that you're born with that disables you. But there's a whole lot of gray area in there. So there's no black and white answer, if that makes sense. Okay, so HMOs and PPOs. HMO, this stands for Health Maintenance Organization. I know it says insurance on here. It can be called that too. This is a managed care insurance. So an HMO, you've probably heard these words before. Maybe you just didn't know exactly what they meant. Here's the thing with an HMO. It's typically a little bit cheaper, and employers can get them at like a group rate kind of thing. So you'll see them a lot. But the kicker with the HMOs, even though it's cheaper, they are the ones who manage your care. That's why it's called, that's why it says managed care, because they manage it. They're the ones who determine. They can say, let's say your doctor says, I think, she needs to have this mole removed. Well, the insurance may say, no, we don't think so. It's not big enough or whatever. They set up their own guidelines, and they can say yes or no, regardless of what you think or your doctor thinks or whatever. It has, anyways. You also have a specific doctor. They assign you a doctor. It kind of depends on the HMO, but like one time I had a patient with the Medicaid HMO. He lived in Quinlan. You know where Quinlan is? Kind of not far from Greenville. Okay, the HMO assigned him a primary doctor in Fort Worth. Okay, one, he was disabled. Two, he couldn't even use his feet. And he had to call like a Trax bus to pick him up, take him all the way to Fort Worth. They had to wait on him all day. He'd say, but they assigned him that primary doctor, so if he needed anything, he had to go to that primary doctor. And that primary doctor could refer him to a vein specialist or a neurologist or whatever, but he had to go through that doctor before he could do it. And they'd have to approve it. It was just a nightmare. Now, not all HMOs are that difficult, but they can be. And that's part of being with an HMO, is they kind of choose what you can and can't have. And that's how I think, well, no, I should say I don't really know that. I think I know that. But, out-of-pocket expenses are set, so they kind of determine how much money they're going to spend on you for that year or whatever. There's just a lot more limits with HMOs. Now, again, some HMOs are, I was on an HMO when I worked at Children's, and it was great and easy and it worked really well for me. But they're not, you have to really read the fine print with them. They can be good, but they can also not be. Specialty care has to be submitted for approval. They can always deny it. Okay, PPO is exactly like what it sounds like, preferred provider organization. So you get to pick the provider that you prefer. Okay, they basically have a list, like Blue Cross Blue Shield has a big long list of people that take their insurance, and you can choose whoever you want to see on there. You don't have to have referrals and stuff like that. Typically, maybe a little more expensive though, the PPO. Says the insurance company pays a set amount and the insured pays a set amount called a co-payment. So write on there, note somewhere, co-pay or co-payment. Either one of those will work. Co-pay or co-payment. Okay, your co-pay or co-payment is a set dollar amount. I'll write this down. A set dollar amount for a service. A set dollar amount for a service. Make sure I say this correctly. Or a specific dollar amount is how I worded it on the quiz. Specific or set, whatever. Okay, have y'all ever looked on your insurance card or someone's insurance card, you guys, and it says, you know, your name or whatever, and then it has copay, and it might say $25 or $20 or something like that. What that means is that regardless of how much that doctor's visit actually costs, like let's say you go in and they charge $150 for a doctor's visit, which is pretty typical. Your card says copay $25, you're only going to pay that $25. If that doctor's visit was $300, but your copay was $25, you're still just going to pay the $25 for copay. Set dollar amount that you pay per service. Sometimes it'll be like emergency room, it might be $100 or something. Okay, add this word on there, co-insurance, CO-insurance. Okay, co-insurance is a percentage of the cost, of a service. So this is a percentage. So let's say my co-insurance is 20%. If that doctor's visit cost $100, how much am I going to have to pay? $20, right? Because it's 20% is the co-insurance. Okay, if it's $200, I'm going to have to pay $40 because that's 20%. Does that make sense? So a copay is a specific dollar amount, and a co-insurance is a percentage. Make sense? And I'll explain that more in a minute. Okay, add this word on there somewhere. This is deductible. D-E-D-U-C-T-I-B-L-E. Okay, deductible is the amount you pay before receiving full benefits. Amount you pay before receiving full benefits. So, for example, C-section. My C-section, I'm guessing, I haven't seen all the bills yet, but I'm guessing was somewhere around probably $30,000 for that surgery. my deductible on my insurance that I have is $4,000. So what that means is that before my insurance will pay anything else, for me at least, I have to pay that $4,000. I don't necessarily have to pay it all up front. It's not like I just without $4,000 out of my pocket and hand it to them. I can pay that off. But before I'll get any of my other benefits, I have to pay that $4,000. Now, after I've paid that $4,000 deductible, then I have to pay a 20% co-insurance. So what that means is, so I don't lose you guys, lots of numbers going on. So if my surgery was $30,000 and I've already paid $4,000 for my deductible, that leaves me what, 26? Now I have to pay 20% of that. What is that? Somewhere around $5,200. $5,200. Okay. So, but the good news is I actually have what's called an out-of-pocket maximum. And we said out-of-pocket is just anything that you pay out of your pocket. So my out-of-pocket max is actually like $8,000. So that means I paid $4,000 deductible and I had to pay $4,000 of my 20% or whatever up to then I don't pay anymore. Then they pay 100% of everything. Doesn't really sound that great. Still get 8,000, but pay that out over the next 10 years or something. But so it gets crazy. And this is actually my insurance was a lot simpler this year than it was the last time I had a baby. Then it got crazy. So I had co-pays too. So I know that this looks like foreign language probably, but I just want you guys to be familiar with this, with the terminology, because someday you guys are going to get a job and you're going to be like, what insurance do I choose? And I want you to have an idea of, at least terminology-wise, what are you looking at? What else? Oh, your premium. That's another word you need to write down. Premium. And your premium is the price that you pay for insurance. So like your monthly price, or however often you pay it. Price of the insurance. So like, let's say I pay $200 a month to get insurance. That's my premium. And unfortunately, your premium does never build up towards your out-of-pocket. That's just paid on top of everything. Lots of money involved in healthcare and insurance, unfortunately. Okay, there's another word I want you guys to write down. COBRA. C-O-B-R-A. All caps. This is insurance that you, let me rephrase that. This is, yes, it is insurance. Insurance that you pay month to month. Let me see how it works. After you become unemployed. So I'll give you an example. So let's say I'm teaching here at the school and I decide not to teach anymore. Let me finish and then I'll let you guys go. If the school, let's say the school's been paying $200 towards my insurance every month. They don't have to pay that $200 every month, but I still have the option to stay on the insurance. I just have to pay for the full amount, but it goes month to month. So this month I pay month for it, next month I pay for it. Okay, I'll finish this probably in a lecture for you guys tomorrow. I will see you guys Thursday.